Good morning, everybody. As you're aware, the Treasurer is about to deliver the budget at noon, so we wanted to make sure we got this message out as early as possible. So as you may be aware, to 8 p.m. last night we had 5 cases in New South Wales. Since 8 p.m. we've had an additional 7 cases. Now, all of those cases bar 2 are in isolation. All those cases bar 1 are directly linked to existing cases. The one exception is a primary school student at St Charles in Waverley, and the school is in the process of notifying parents. But can I urge parents to wait for instructions from the school, because we're keen to make sure that students and parents have access to testing, and we also want to make sure there's not a rush with all parents descending on the school at the same time. So we want to make sure, obviously, that it's managed in a good way, and we thank the school already for starting that communication process. So whilst all the cases are in isolation bar 4.2, one of which is this student, there's an additional case which is linked to an existing site, the Westfield Bondi Junction, but obviously close contacts of that case are in the process of being notified, and Dr. Chant will go through that in detail. As a result of what's occurred overnight, the New South Wales Government will be extending the existing mask wearing provisions for an additional week. So previously, Wednesday midnight or Thursday morning at 12:01, the existing ask in relation to masks was to expire. It will now continue in a mandatory way for an additional week. But we'll also be extending it to all of Greater Sydney. So that means excluding the Central Coast and excluding the Hunter, but all of Sydney will now be required to adhere to that compulsory mask wearing indoors for hospitality workers when we're going shopping, when we're going grocery shopping, when we're going to events inside. It's only when you're really eating or drinking indoors at a venue that you can't or shouldn't be wearing a mask. But in every other circumstance, if you live or are in Sydney, you must wear a mask for an additional week beyond Wednesday midnight. Additionally, those 2 local government areas in Wollongong and Shell Harbour, which had compulsory public transport for that period of time, will also be required to have the mask wearing indoors in the same way that we've asked all of Sydney to do. Now, there is no doubt an increased level of concern given the additional number of cases, but as Dr. Chant said yesterday, we did expect, given how absolutely contagious the virus is, we did expect that household contacts that are already in isolation were likely to get the virus, because as Dr. Chant will repeat today, as we did yesterday, unfortunately a number of people who've contracted the virus have done so in a very fleeting way, literally being within less than a metre within somebody but sharing the same airspace without any physical contact has still meant the virus has managed to transfer. So a very fleeting exchange or a very fleeting coexistence has actually allowed the virus to transfer, and that just highlights how contagious it is. Now, at this stage, we feel that the response we're having is proportionate to the risk, because we did predict and assume that all the household contacts, in fact one family managed to contract the entire disease, parents and 4 children. So just to demonstrate to you how contagious this is. So we anticipate in coming days that those in isolation with a household contact are likely to develop the disease, given how contagious it is. So just to recap what we're asking everybody to do, everybody in Sydney has to now follow that compulsory mask wearing in indoor venues, including public transport, not just those 7 local government areas, but all of Sydney. That means hospitality workers, retail workers, all of us that go and visit those retail outlets, go shopping, for all indoor events. Obviously, workplaces are excluded, but all workplaces have a COVID safety plan. So if you're in a workplace, you have to maintain the social distancing and make sure your workplace safety plan is in place. But outside of that, mask wearing will be compulsory for at least another week. So from Thursday morning, 12:01 a.m. for another week. This is an important measure for us. We do want to get on top of this. As I said, the one The one thing that wasn't a surprise to us was all the household contacts getting the virus. But obviously the student at St Charles Waverley means that school has to have a deep clean, that parents will be advised, and we just want everybody to get tested. And Dr. Chant will also describe how we've increased the number of days that we want people to get tested if they're at the Bondi Junction Westfield. Clearly that shopping centre has generated a number of cases, and we just want to make sure we've captured everybody. It could involve thousands of extra people having to get tested now, but we have the capacity for that to happen. We're urging people to come forward and get tested. The higher number of tests that we have, the better we'll be in making sure that we haven't missed any strains of community transmission. Now I'll ask Dr. Chant to give her update and then we'll take any questions. Thank you.
Thank you, Premier. So I think it's very important for the community to discriminate between the cases that have occurred when people have been in isolation for the full period. So in terms of close contacts, we obviously test them on the way in, so we're assured that they're negative, and then we are expecting a proportion of close contacts to test a positive, and obviously household contacts, due to the nature of that intense contact, are more likely to transmit. And so what we've been seeing over recent days is actually somewhat pleasing, because if we had not identified those cases, they would have been out in the community with generating further exposure venues. The two cases that are demonstrate risk to the community are a young lady in her 20s who we believe, acquired the infection at Bondi Junction. She's a worker at Bondi Junction, and we believe that she was exposed again, probably through fleeting contact with one of the infectious people as they moved around Bondi Junction. So for this reason, we are calling out for anyone who has been in Bondi Junction, including the car parks, any time between the 12th of June and the 18th of June to get a test. Now, obviously, if you've been to one of the close contact venues, you should have been contacted about being in isolation for the 14 days, or the casual contact venue, check the specific advice. But if you don't have symptoms and you're just going forth because we're asking you to attend, you do not need to self-isolate, but we are asking you to minimise your contact with others until you have a negative test. And this is because we're casting the net very wide, because we want to pick up any of these inadvertent transmission. You can see how if we miss a case over the next cycle of 3 days to a week, we may have many cases coming from that single missed case. And so at the moment, we just want everyone to come forward and get tested. The other case that we're under investigation, and literally this test result came in a few hours ago, and we want to thank and acknowledge the cooperation of the St Charles Primary School for their cooperation. But can I again reiterate what the Premier has said? The school is working with health officials to develop a plan for the children to be discharged home to their parents, and we also want to provide advice and a mechanism to get testing, because obviously we want to find out how this child was exposed and establish that, because cases where we don't understand the acquisition mean that we've missed cases. And in this case, we don't have, on preliminary information, a source for this child's exposure. So we are looking for an intermediate source. So please, parents, I know that there may be a level of concern, but this is in hand. The school and public health will be communicating with you a safe plan for the students to go home, and also the testing arrangements, which are critical for us to understand this situation. Thank you.
I just want to address the issue of QR codes. We know that QR codes have been mandatory for quite some time in areas such as hospitality venues, so restaurants and pubs and clubs and so on, or pubs. What I want to emphasise is that people need to use those QR codes. In the hospitality facilities, use the QR codes. If you go to a cafe or restaurant, use the QR codes. I've certainly detected just in my wandering through the city a degree of apathy. Some of the restaurants and cafes are not asking people to use the QR codes. A lot of individuals are not using them. So we really need to take this particular virus and the variant of the virus extremely seriously. I want to add to this that obviously in shopping centres there are facilities such as nail salons and so on that have a compulsory requirement, and we have been asking people to use QR codes in retail shopping centres and particular shops, but we are actually now emphasising to each of those shops and to the large shopping centres that you must make available those QR codes. We may be knocking on your door asking who's been in your shop. We need to have that information. New South Wales Health Tracers need that information. I also want to emphasise one other fact. Last year we talked about this particular virus when it first came to our shores as being obviously dangerous, but it wasn't a long jumper and it wasn't a high jumper. We talked about the necessity for the 1.5 metres social distancing. That is still crucial, but we also need to recognise that this Delta variant, the Delta variant of the COVID virus, is actually a gold medalist when it comes to jumping from one person to another. It is a long jumper. So take it very, very seriously. Follow the guidelines that New South Wales Health and the New South Wales Government have established. We're all in this together, but if we want to get out of it together, safe and sound, we need to take very seriously using QR codes and making sure we maintain our distance wherever possible. Thank you.
Dr. Chet, just on the St Charles child, given it's only a few hundred metres from Westfield Bondi Junction, is it safe to assume that you think that there has been some contact there? And secondly, with that, the lady in her 20s, are you saying that someone can be infectious, a few moments after catching it initially?
No, and this is the whole premise. So let me take the questions one at a time. So the first one is, no, there is this period, and we think it's probably about 24 hours at a minimum, but it's actually up to 14 days where you can become infectious. And that's why we ask people that are close contacts to be in isolation for that period. So there is a period. If you've just immediately been in contact, you are not infectious yourself. So that is why we're asking people to immediately get a test after we usually are getting to people very quickly within 24 hours of their exposure. And what we're hopeful for is we actually get to people before and put them into isolation, and we have a negative test when they go into that isolation. That means that they have not had the opportunity to then go and transmit to the community. So that's the whole way contact tracing works. And earlier this week, we've seen cases where when we have gone in, the families were negative. So in the cases that the Premier gave as an illustration today, all of those close contacts in that household of 5 tested negative when they were put into isolation, but many days later, some of them developed symptoms, and when we went back and retested everyone, the whole household actually acquired the infection. So this highlights the importance of adhering to us. When we tell you you are a close contact, it really does mean you are at risk, and the symptoms of COVID, particularly for fit young people, can actually be quite mild. So don't risk it. Please follow the health advice. We rely on the community. We do check, but we do rely on the community to comply with our advice. So that's in relation to that. In terms of the child, the primary school child, I'm not going to speculate. The child has been interviewed with the parents. All avenues of investigation will occur. I suppose what's pleasing is that it's in the geographical area that we know we are concerned that transmission could have happened. I would be much more concerned if this had been a case in an area where there are no geographical links. But we are looking for those crossover points, and what we like to do is find that more specific person who's transmitted to that person, and if we can, capture the time of event to make sure we're not missing people.
Dr. Chan, can I clarify, you will be asking the entire school community at St Charles, parents, teachers, front admin, the students, everybody to get a test? Is that
No,
right?
there will be a testing plan that's being developed. Now, given we know that social media goes out very quickly and that word had already spread, we are saying this, but at the moment, parents have got to need to listen to the communication from the school. A testing plan will be developed which will prioritise, and they will understand, mixing of classes, what the specific circumstances is at St Charles. and that will be communicating to parents. So I'm not going to second guess that. Public health officials now are working with the school on that information, and I just ask parents to be patient, and we can have a very good process in facilitating those children to go home.
So from what I understand, it will be targeted at close contacts and who's been with who, but children, like the kids in year 3, will be hard for them to say, describe their
all of those matters get assessed, but obviously we have a testing plan. We focus on those most at risk of getting that exposure, and schools are set up in different ways. Let's not speculate. I leave it in the hands of the principal, who is best positioned to, and the public health authorities there that are working with the school principal, who know the layout, who know the way the children move, who know which playgrounds children are permitted to play on. Each school is different, and can I just thank the way that we've worked throughout this pandemic with the schools and the cooperation we've received from them.
Are you concerned, Dr. Chant, about the transmissibility around children? Like, to understand this variant perhaps is more transmissible around children in this instance?
I think we know that the variant is more transmissible overall, and we would expect that means it's more transmissible amongst children as well. I think that let's just get to the facts of how the transmission occurred in this case. As I said, this is the first case where we need to get a bit more information. But as you can see, we're actually going out very, very quickly with information. And thank you to the community for those QR codes. The quicker we can get to people who are close contacts, we can actually get them isolating before transmission has occurred, and then it limits the number of new infectious locations. And that's what we want to see over time. We want to see a reduction in infectious locations, and obviously by mask wearing we also minimise the risk associated with each of those. We still might deem you a close contact, but your risk of acquisition is reduced if everyone's wearing masks.
Premier, has this been made more difficult for the fact that you don't QR code going into a Westfield or a big...
Well, certainly it's highlighted the fact that we need to do that. So can I flag that New South Wales will be doing that? At the moment, there are categories of retail outlets that are required to have QR codes, including nail and beauty salons, hairdressers. All those places already have requirements for QR code, but we are in the process of extending it to all retail outlets. I think that's a first in Australia. But as we've done during the pandemic, whenever we've had to be flexible and adaptable and adjust, we have. So can I flag that New South Wales is moving towards making all retail outlets compulsory, and today Minister Dominello will be in touch with the peak bodies to let them know, but that is definitely what we'll be doing moving forward. And it's really important for us, because what New South Wales has managed to do to date is, yes, we've asked everybody to wear a mask in certain settings, but we're still allowing people to freely get about their business, although we're asking everybody to be cautious and to limit their activity unless they absolutely have to do certain things. So whilst we do have this current outbreak, we've managed to keep everything open, and that's our intention. If we want to do this for the duration of the pandemic, we're going to have to adjust and make sure that things like retail outlets do have that compulsory QR code already. But I do want to stress a number of categories of retail businesses already have to have the QR codes in place, but others where you'd assume someone would go in for a very short period of time previously didn't. But I think everybody understands the benefit of that. It means we can all keep things going, we can keep shops open, and people naturally are regulating. As you walk around certain parts or observe certain parts of Eastern Sydney, it's obvious that people have listened to the messages. There's less people moving around, less people going out unless they have to, and certainly ask everybody to step that up in the next week. So everybody across Sydney should just think about where they're going. Unfortunately, given how contagious the virus is, we need to assume that if you're with a number of people, a small number of people, or if you're having a meal with somebody, if anyone in that group has the virus, everybody in that group will get the virus. That's how contagious it is. If you're spending, a period of time with anybody who has the virus, it's not like other strains where it's less contagious. We know that this will soon become the dominant strain. We've known about this for a while, but at this stage, we feel the measures we're putting in place are very proportionate to the risk that's posed. But obviously, as we say all the time, please stay alert. Please continue to listen to our messages, and we'll update the community if and when we have to.
Just a few more minutes, please, guys.
Sorry.
Is a lockdown still off the cards at this stage, or will you have to look at a targeted lockdown like we saw on the Northern Beaches?
Yeah, well, at this stage, obviously we follow Dr. Chant and the health advice. And at this stage, because all but one case is linked to an existing case, and that one case was only discovered literally a few hours ago, that gives us a degree of confidence that what we've asked people to do is matches the risk that's there at the moment. But if that changes, if we suddenly get a number of unlinked cases, and if we suddenly get them outside of the geographic region that they're kind of concentrated in, that will obviously adjust the health advice and we'll respond to that. But at this stage, given Dr. Chant did advise us already that she foresaw that household contacts would get the virus, and I think this demonstrates how important it is to isolate when you're asked to isolate. You might have a negative test, you might not have any symptoms, but subsequently during that 14-day period, you suddenly start feeling unwell, get tested, and a family member who was negative on day 1 might on day 5 or up to day 14 suddenly become positive, and that's why it's really important for everybody to listen to the health advice. And please also again refer to Dr. Chan's updated advice in relation to Westfield Bondi. Clearly, there had been a number of transmissions in and around that shopping complex, and Dr. Chant and Health have updated the dates at which you need to get tested and isolate if you hadn't already followed those instructions.
I mean, are you satisfied that the mask mandate is being followed and also enforced? And do you know if any fines
Yeah,
are actually being handed out?
we're certainly, I don't know if any fines have been handed out, but I certainly know compliance is picking up, and that comes down to us as well in being clear in our message. And now that there's no doubt, it's not just those 7 local government areas we'd identified, it's all of Sydney, not the Central Coast, because the health definition of Greater Sydney included the Central Coast. So it's not the Central Coast, but it does include the Blue Mountains. It does include those 2 local government areas in Wollongong and Shell Harbour because of those cases that we'd had down there. So I think when the public understands and gets the information, they're following it. The biggest challenge for us is just to make sure everybody gets the information. So as usual, we ask people to make this requirement effective immediately, but compliance won't start till 4 o'clock today. We give people a couple of hours, but if you do have a mask, we ask that you exercise that immediately to prevent any super spreading events. The real challenge for us at this stage is to prevent any super spreading events, because we know that if you are in a group of people, if one person has the virus, the level of contagion is so high that we're concerned that everybody might get the virus.
Dr. Chant, can I ask, are any of the newly identified cases, 10 since we went to yesterday, are any of them linked to Wollongong Private Hospital at all, and does testing keep on going there?
No, we have no concerns about transmission at Wollongong Private Hospital.
Last one, please.
Last one.
Were you successful in getting more vaccines out of Cabinet yesterday?
Well, as you may have heard, we did receive 50,000 extra Pfizer vaccines, but one thing that gave me assurance, having made a number of public comments and raised the issue with the Prime Minister directly prior to the meeting, is that all states will get vaccines proportionate to their population, and that's what I've been arguing since day 1. We know until the vast majority of our population is vaccinated, we are going to get these outbreaks. Yes, states deal with them differently. Yes, they differ from state to state, but at the end of the day, what is fair is for every state to get its proportion. Thanks, everybody.